Sorry, we'll start that again, shall we? I'd like to welcome members and guests to the second Health and Wellbeing meeting of the municipal year. I'd like to confirm that this is a hybrid meeting and remind members that as a committee of the council it's being recorded and streamed live on the council website. Now, Councillor Ralph is joining us virtually. I've approved that. He's got a problem with the trains, so at least he's here online, which is good. I've received apologies for this meeting from Julie Rogers, Claire Panica and Dr Anil Khalil. Is there any other apologies that we're aware of?
Anthony McKeever from MSE sends apologies.
Thank you.
And just one more, Chair, from Rita Fakiria.
Thank you. So, temporary Chief Inspector Terry Fisher will be representing Essex Police and will be attending virtually, I understand. So, moving on to agenda item number 2, urgent items. I've not received any urgent items in advance of the meeting. So, agenda item 3, unless anyone's got any urgent items they want to... No. So, agenda item 3, declaration of interests. Do any members attending today's meeting wish to make any declarations of interest? No. Agenda item 4, minutes from July Health and Wellbeing meeting and new action and decision log. Minutes and actions arising from the 18th of March meeting provided at page 5 of the meeting papers. Are members content that the minutes are an accurate record? Yeah? Yeah. I'll take silence as a yes.
Agreed.
We'll now consider the action log and decision log, which reflect the minutes of the last meeting. So the decisions, there are currently 3 decisions open on the log. Decisions are recorded on the log and are closed following members' approval at the preceding meeting. Actions and decisions number 2, members agreed to the changes proposed of the board's terms of reference. Decision number 3, action members approved the Better Care Together Thurrock, the case for future change as the delivery mechanism for delivery of goals 1 and 3 of Thurrock's new health and wellbeing strategy. And action and decision number 5, members approved the health and wellbeing strategy in the formats presented and approved the plan to launch the strategy in July. This has now been completed. Are members content that those decisions of them to be closed and recorded as an accurate record on the log?
Agreed.
Agreed. Yeah. Can't see Councillor Ralph, so I'm struggling to... it's too small for me to pick up who's on the screen. Lovely. Thank you. Are members content that those decisions... Oh, sorry. There are 2 actions open on the log. Action number 1, Secretariat to liaise with the Chair of the Board to plan the sequencing of the themes for each meeting. And the forward planner reflects the themes proposed for the remainder of the municipal year following consultation between Secretariat and colleagues and partners. October Board will consider domains 1 and 6, staying healthier for longer and community safety. December meeting will consider domains 3 and 5, person-led health and care and housing and the environment. February meeting will consider domains 2 and 4, building strong and cohesive communities and opportunities for all. I suggest that the action number 4 is closed, yeah? Secretariat to liaise with the Chair to arrange bespoke information sharing sessions for staff as required. So it's the above ones that I've just read out that we want to close. Yeah. Sorry. Yeah. That's why I need you sat with me, Darren. Excuse me, everybody. It's only second meeting in. I'll get better at this. I promise. Yeah, so are members happy to close those actions that we just said?
Agreed.
Yeah?
Agreed.
So I suggest that this action is closed at 15. Action number 4, Secretariat to liaise with the Chair to arrange bespoke information sharing sessions for staff as required. This action arose following my offer as Chair to provide some bespoke sessions to staff on my role as counsellor and portfolio holder for adult social care and health and Chair of the board. I'll liaise with the Secretariat following this meeting to consider how best to take that action forward. Yeah, and I suggest that this action remains open. Do members have any comments or suggestions on the actions and the decision log? Anything that you'd like to add, take away? It's a very quiet meeting today. Okay. So we move on to agenda item 5, housing strategies. We're moving on to, we've got 30 minutes for this item, so covering a report and supporting documentation is provided at page 13 of your papers. 30 minutes have been provided for this item, comprising 20-minute presentation, 10 minutes of questions and answers. To help ensure all items on the agenda are provided with consideration, Darren will be adopting his 2-minute flag warning. Are you going to walk around the room as well for us? So Darren will alert the presenter, I like the sign, when there's 2 minutes remaining for their presentation. So I'd like to ask Ryan Farmer and Eloina Sorbjan to introduce this item, please. Thank you.
Thank you very much, Chair. I'm very pleased to be here today to talk to you about the housing strategies 2022 to 2027. As a local authority, it's really important that we have a document that clearly sets out our aims and ambitions for housing across the borough. And we're not just talking about council homes, it is homes of all tenure types across all areas of Thurrock. The previous housing strategy was adopted in 2015. It was due to expire in 2020, and although work started to refresh that in late 2019, world events got in the way. So we weren't able to complete that. But at the earliest possible opportunity, where things were a little bit more settled and we could turn our attention to developing a strategic vision for the future, we absolutely did so. So we've developed this new housing strategy, which has considered changes in legislation, regulation, market trends, impact of welfare reform, new opportunities for meeting housing needs in Thurrock, and also the turbulence and uncertainty of the past 24 months throughout the COVID-19 pandemic. The report that is presented to you today sets out the strategic aims and objectives of the housing strategy 2022 to 2027, as well as 2 other supporting strategies, these being the asset management strategy and the resident engagement strategy, all for housing for the same period of time. I am pleased to say that these documents were presented to Cabinet on the 13th of July and were approved. But for the strong links to health and wellbeing throughout all of these documents, it's really important that we've come to you today to share our vision with you. So, moving on to the vision, really. The foundation of the strategy was an understanding and an appreciation of the strong links between housing and health. Access to a safe, secure, stable, suitable home is the bedrock for living a good, well, happy life. And from the outset, we knew that was something that needed to run all the way through the housing strategy. When we talk about a safe home, it can mean many things. It's about being hazard-free, it's being maintained, it's compliant, but it's also that perception and feeling of safety. It's a little bit harder to measure, but is just as important. Secure homes, we're talking about security of tenure, giving people the opportunity to put their roots down in their home and know that they're going to be able to build their life for some time. But secure also means safety again. So there's a couple of different things there. A key factor that we've had to consider is around affordability, and we know that the cost of living is far-reaching as a crisis. It's affecting every aspect of everyone's life, and what an affordable home is, I'm not ashamed to say there's no answer in the strategy about an affordable home. It is so subjective and unique to each individual household, but we recognise this and we'd like to work to understand that a little bit more. We also want this strategy to recognise that affordability of home isn't just about rent and service charges. It's about running that home and maintaining that and having a good quality life. So with all that in mind, we set a vision for the housing strategy, and this is it here. So every Thurrock resident will have access to a safe, secure, suitable and affordable home that meets their needs and aspirations, serving as a foundation to support their health and well-being. Residents will be supported at home and in their local area through connected services, neighbourhoods, localities and communities to achieve their vision of a good life. What I'd really like to say now is that this strategy has not been developed in isolation. None of these ones, the two that sit underneath that, they haven't been taken as individual pieces of work. We've worked really closely with colleagues developing the health and wellbeing strategy, the case for further change, and I know both of these came to the last health and wellbeing board. And there are themes and commonalities that run through all of them. We've set 8 new principles in this housing strategy for how the housing service will operate. And you will see, if you look at these alongside those in the case of further change, you will see how they are linked. We're talking about looking at what is important to residents, providing services that are in the right place, high quality, at the right time, absolutely supporting health and well-being, minimising bureaucracy, not spending the time or resource on that element so we can maximise the time and effort we spend on providing positive outcomes. Looking at local strength-based solutions and the assets within neighbourhoods and localities. Making sure that, I'll read this as it is and I'll explain it in a moment. So one of these key principles is that we want to ensure that what we do doesn't break the law and meet statutory duties. Now, what I mean by that is there are certain things we absolutely must do, the duties and responsibilities that we have. There are other things where there is discretion and we have the ability to make decisions. As long as we don't break the law and we look at what is best in the needs, what best meets the needs of the resident that we're working alongside, we should be able to explore that to reach the right outcome. And sometimes that might mean that we need to review our practice. And that's about being flexible and adaptable, which is our next principle there. And the final one, and this again was the foundation for the way we develop this strategy, and that's partnership working and collaboration. We don't intend to do anything in a silo. We don't intend for a housing officer to go and make a decision on their own. When we say partnership, it's not just with colleagues across the organisation, with partners, it's with residents. Nothing should be done to, it should be alongside and with. And we really do believe this. Within the housing strategy, we've got four aims and objectives, or 4 key aims. Delivering housing support and services, meeting housing needs, protecting resident safety, and strengthening community engagement and empowerment. Now, I don't intend to go into all of these in a great degree of detail. It's all laid out there within the document. But just as a brief overview of each of these things, when we're talking about delivering housing support and services, our main objectives are really and truly embedding that person-centred approach to housing support and services, taking the time to understand the individual, the family, the household that we're working alongside and what matters to them and what will help them achieve that vision of a good life. And that wording appears in our strategy for a meaningful reason, and that's what we want to achieve. We also want to develop that locality and neighbourhood model for housing services to support the ambitions of the case for further change. And we've started in that direction already, which I'm really pleased to say. Talking about meeting housing need, this is quite broad. There is an element of this which is identifying and providing the right homes for Thurrock based on household needs in Thurrock. That means staying on top of and understanding the needs of Thurrock residents at all times, and they are varied. Everyone has a housing need, and no two households' housing need is the same. And we would like to move away from tick boxes and categorisation and understand what it means for someone to have their housing need met. Addressing the housing affordability crisis in Thurrock. Again, it's really important to stress the point that what one household deems or finds to be affordable is not the same as another. Each household will have a different pressure, a different challenge for wildly different reasons. We absolutely need to work towards addressing this as best as we can, but it is such a complicated area that if any document said that it had nailed and understood exactly the definition of affordable, I would challenge that, because there is no single definition of affordable. And that recognition that it is so subjective and personal is another reflection of the fact that we are looking at the household and the family and the individual, not just I don't know, process and policy. It means more. Another objective in this meeting, Housing Need, is about preventing homelessness and ending rough sleeping in Thurrock. We've had some great work recently, and we really want to continue in that vein. We want to deliver sustainable estate and housing regeneration. And when we say sustainable, there is the environmental side of sustainable, but providing estates and homes that people can maintain and manage and build that foundation and live that good life in. And the last thing here is about our model for sheltered housing provision and how we might be able to review that, strengthen it, and find some different ways of delivering that type of service. Moving on then to protecting resident safety. This is, again, a very, very broad area. Paying respect to the fact that we're not talking about just council-owned homes. We'd like to use the strategy to improve warmth, safety and standard in the private sector homes for a range of different reasons. We want to invest in and maintain our own homes, and this points directly to the asset management strategy that sits underneath this main one. We strongly believe in strengthening community safety and preventing antisocial behaviour. As I was going through the engagement activity for this strategy, it came through very strongly from residents that it's something that matters, and it's the feeling of safety. A place could be as safe and secure physically as you can make it, but if people don't feel safe, then that's just a bigger challenge. Tackling domestic and sexual abuse and violence is quite rightly a very, very strong consideration within the strategy, as is supporting vulnerable adults and children. And again, we're doing some really good work in that regard and are excited for that to continue for the next 5 years. And finally here, improving estate standards. That goes hand in hand with that feeling of safety I was talking about, and is a real focus for us. And then finally, the last aim we had was strengthening community engagement and empowerment. We have two objectives here: improving resident satisfaction and access to information, and strengthening, integrating and diversifying community and resident engagement. This section is becoming ever more important, not least because of growing changes in regulation, a strengthened social housing regulator. But it is the right thing to do, because it is right that we listen to our residents. They have a voice that is heard. And again, there's some really exciting work we're looking to do in that regard to make resident engagement truly meaningful and have people be able to share their thoughts and views with us and be listened to. I won't go into any detail really for the asset management strategy and the resident engagement strategy, only because I could do another 20 minutes on each of those. But there are elements in both of those strategies that go into further detail from what is already there in the housing strategy. They're important areas of work. We're talking about making places that are good quality, that people are proud and pleased to live in, that they feel a part of as a community, and that they have some say in control and direction over. From an engagement point of view on this strategy, it was a real joy for me to be able to go out. I attended community forums, residents groups, committee meetings. I spoke with colleagues and partners and tried to achieve as broad engagement as I could so that people's voices were heard, and not a single word of this strategy was written before I'd completed all of that activity, and I'm really proud of that. I've mentioned about the alignment with the other strategic documents, and I really think that is such a significant factor in this. It means that all three of those, the health and wellbeing strategy, the case for further change and the housing strategy, can work together and achieve something greater than any one of those could, because there is that strategic alignment. I would be very, very grateful to receive your thoughts and comments. I know that this strategy has now been approved and agreed, but this is our commitment for the next 5 years, and I would like to know that in the future we'll be delivering positive outcomes alongside this board, and I'd look forward to coming back to talk to you again in the future on how we get on. So I'll wrap up there and and pass over for any questions you've got. Thank you.
Thank you, Ryan. Before I provide my thoughts, I'd like to invite members of the board to ask questions. I noticed Councillor Ralph has had his hand up on screen, and then if we go to Councillor Muldowney and Councillor Lydiard after that, is that okay? Thank you.
Thank you, Chair. Yeah, thank you for the report. I think for me, when I look at the strategy, I understand the need for it, and I like the words use of community and safety. I think what I disagree with, that over the years, community has been seen as almost overcrowding development areas. You're almost forcing people on top of each other. I think from the health and well-being side of it, space is very, very key for a healthy environment. And that does mean things like decent sized gardens. We do have, if we remember somewhere like Summercoats in London, where the strategy looked very, very good on paper, but with not providing much space, everyone was forced out in the streets to play and all that. Now that is great, it makes friends and everything, but you can't get away from the mental benefit of having a decent sized garden and not a postage stamp garden, and space around the area around your own home where you're not forced to live in other people's shadows all the time. So I think the strategy is good. I just think when we come to the community and the mental health side of it all, space is also good. That's just my view on that. Thank you.
Did you want to respond to that?
Of course, thank you. Thank you, Chair. Thank you for the comments, Councillor Ralph. I think that the last couple of years have shown us how important space is, and you make the right point around mental health. I know for our own developments, we're particularly mindful. We really aim to deliver homes and spaces that are high quality, that people can live those good lives in. I know there's a lot of work in that regard, and it's something that we do take seriously. The Heathland Way, Claudian Way development in Chadwell St Mary, the fact that we've got homes there, 3-bedroom houses and bungalows, we haven't followed that route of densifying and cramming as many units in the space as we can. We've aimed to deliver good quality homes. So it's certainly an aspiration that I would say we in the housing service share. I know there's wider conversations with local plan, and I don't know what might be able to achieve in that regard, but rest assured it's something we certainly take seriously in the housing service.
Yeah, thank you. I just think that when we talk about affordability and the council housing, it does seem obviously there's the need for that standard to have the better gardens or the bigger gardens, because they are the communities that we can get problems with. I grew up on a council estate and we've all got nice gardens here, and we all played in our gardens, and that I just think going forward, if we look at affordability, we go, because they're affordable, we're going to cut down the garden size, and that can generate problems. I just want to bear that in mind going forward.
Thank you, Councillor Ralph. Councillor Muldowney.
Thank you, Chair. First of all, I want to say I think it's really great policy. As I read through it, I was sort of continually delighted at the policy. I think it's really ambitious. I think it's going in the right direction. I think it's using things that are already working well in other areas of the council, like the resident-led approach, and putting them at the centre, and the flexibility and empowering our frontline staff to be able to make decisions. I think it's all excellent. I think it's definitely in the right direction. There were lots of things in there that I was really happy about. I'm really happy to hear you say, Ryan, that you did a lot of engagement work and you didn't start writing the policy until you'd done all that engagement work. I'm a little bit sad that I don't remember you coming to Chadwell St Mary Community Forum, because I would have loved to have spoken to you about it. But I'm sure there'll be more work to do along the way, and you've always got an open invitation, because housing is a big part of my casework as a councillor. So, I'd be really happy to partner with you in making the solutions relevant to the housing need that we've actually got, which I've always thought we were doing it the wrong way round. We we should be looking at what housing need we've got and actually planning based on that. My concern is, you know, which is something out of your control, obviously, is how is this going to be funded? It is very ambitious. I think it's right that it should be ambitious. I'm really glad to see that there's this ambitious policy at last, because we've sort of been languishing a little bit with housing, and we haven't really built any affordable housing for quite a number of years now. Very, very low numbers, certainly not to the extent that we should be building to meet the need. So I just had some questions about affordability. First of all, I do think affordability is different things to different people, but I don't think there are going to be wildly different reasons why people are not going to be able to afford housing moving forward. I think obviously we've got a very deep cost of living crisis, we've got inflation going up, we've also got the local financial position, which impacts how ambitious we can be in all of the areas of the council. So I don't think there's going to be, I don't know if I agree that there's wildly different reasons. And I'm glad that the reason that I like this policy as well, because it was grounded in reality. You do recognise that the council will need to explore external funding and extra support from central government to deliver this strategy. And later on in the strategy, I also saw that there was a suggestion that there might be borrowing in order to build. That is also something that I would support and be in favour of. I think we should have been doing that as soon as we were allowed to in 2018, but better late than never. I was just wondering, in terms of, can you put some kind of ballpark figure about what the shortfall is from your experience? So obviously we do have some resources in the housing revenue account, but what is the shortfall? I mean, do we need twice that amount of money to deliver this strategy, or is it 50% more? Are you able to give a rough idea of the road we have to travel?
Yeah, I think Ian said he can respond to that bit, and then Ryan, if you want to come back on the other bits.
Let Ryan go first. Just go on. That was just it's a really good question, and thank you for your other comments. I think it's slightly more nuanced than you suggest in terms of both the types of funding and the broader system budget. So in terms of asset acquisition of further building, then that can generally be financed, as you rightly say, through borrowing against the HRA, and it's interest-only borrowing, and the rent coming in services the borrowing. So those models, they're getting harder to make stack at the moment because of interest rate rises, again, as you rightly point out, but that there isn't necessarily a shortfall. In terms of the broader, I think the housing solutions element, the allocations and the homelessness support, what we want to do, and as Ryan, I think, has set out, is to create integrated locality teams, professionals, and that kind of human public service. So bringing together at neighbourhood level professionals from our health colleagues, from adult social care, from the third sector, and from housing, and Evelyn and Ryan are already doing some, I think, really exciting work on a locality model. As part of that, ultimately, we need to integrate the money as well, because residents often don't present with a housing problem. They present with a housing problem that's overlapping with a mental health or a physical health problem, with a care problem, with an addictions problem. And at the moment, the way we've set the system up, those services are provided in silos. And what happens is where you get these complex cases that are the high-cost cases, they bounce around the system. And it doesn't help the resident, and it doesn't help. It's not efficient for services. And we end up spending lots and lots of money and not solving the problem. So I passionately believe there's a significant element of what I call failure demand in the system, where we're not solving residents' problems because we don't offer them an integrated solution. And if we can integrate the money, then the pot becomes much bigger, and you start to address that failure demand. And that in itself funds, I think, quite a lot of this. In terms of...
Sorry, it's a test. Darren's just... Sorry, everybody, we forgot to mention. We've got to remember that Fridays is test day. Frightens us all.
In terms of quantifying your figure, I can't do that. That's a lot of very, very complex modelling. But my view and our vision is that by doing stuff differently and in an integrated way, we could actually pool resources and fund certainly the support elements of this. I'm sure it's not a figure answer, but hopefully there's some way to explaining our thinking.
Thank you, Ian. I mean, part of my point was the point Ian was making at the end there. I think the approach that we're proposing, that we're not proposing, that we're committed to, it is one that is far more integrated. That the failure demand, as Ian said, the wasted effort and resource and time is, if we can tackle that, we go a long way towards it. It's better for the residents, it's better for us. We can find far better solutions. Just on the affordability, I mean, you are right. There won't be wildly different reasons for why someone might struggle for a home to be affordable, but there are lots of models out there that make the problem look far more simple to resolve than it is. Things where there's simple ratios, I think it underplays the significance of the issue. It's not easy to say a third of household income should be spent on rent. That model doesn't exist. So that was what I was pushing back on more than anything. And that's again, we have a piece of work we're committed to in the strategy to properly understand it for Thurrock. We're not going to try and. That's okay. That's okay. We're not going to say it's quite complicated and we're going to accept it as just being complicated. We're saying it's quite complicated. We really want to understand it to deliver the right type of homes in Thurrock. But I take your point on board. You're absolutely right in that regard.
Yeah, if you could be quick without a long statement in the middle, if you don't mind.
So in terms of affordability, the last time we had a housing report to council, there was no longer a guarantee to keep rents plus service charges for affordable housing under the benefit cap. And obviously we've seen with the Heathling Road development, there was an affordability test for people so that it wasn't open to the people, you know, at the poorest end of the scale, if you like, and some people who applied got knocked out of the process because they were told they just wouldn't be able to afford those properties because of the...
Sorry, can we have the question, because we've got a bit of a queue.
So what I'm asking is there, in this strategy, is there a guarantee that rents are going to be set at a rate that are affordable for those who are on benefits, you know, for those at the lowest end of the scale, or not?
So we are saying in the strategy to sort of a new build we commit to, it will be at affordable rent. And that's, I think, then what takes us to the site, what's affordable rent at any given time. But there is also a statutory definition as to what affordable rent is. So we would absolutely be committing to affordable rents for new builds that are coming within the life of the strategy.
And that would be affordable with the service charge within the benefit cap, is my question.
The benefit cap is absolutely something that we look at, and yes, it will be within the benefit cap.
Thank you.
Did you say you had one more?
I've got more questions, but it's all right. If there's time,
I'll come back to you. Thank you. Councillor Lydiard.
Thanks, Chair, and thanks for the report. I also commend it, as my colleagues have done. In Thurrock, we do have thousands of people who are dissatisfied with the housing, whether they're overcrowded or they haven't got a garden and want to move up to a house. And in my town, Tilbury, this frustration has led to tenants venting their anger on Facebook and blaming the fact that they see, it's probably only a perception, that lots of people from outside the borough are coming in. You're smiling because you know this happens quite a lot. And I'm just wondering, what can we do about that? Because I really don't like it. You know, sort of smacks of racism and all sorts of, you know, nationalism, and I think it's something I would like to, you know, put to bed and somehow.
So I wasn't smiling to make light of the comment of the situation, but it's things that have been heard before. With regards to our own stock, we have a very clear allocations policy. People will only be allocated property within our stock if they meet local connection criteria, or if there is a very significant reason that someone needs to move to Thurrock for their safety. That is how we allocate our council housing. Now, the private housing market is the private housing market, and people can move freely around the country as they choose to. And it is known that there are others who make placements within the private sector within Thurrock that may be from elsewhere. It's not an easy challenge to fix. As long as I've been at Thurrock, it's been a situation. I would like us to engage a little bit more closely with some of those other organisations, and maybe help them see the pressures that we face as a direct result of that activity. But at the same time, there is a recognition that it's difficult for all local authorities around the country. So the private sector question is far more difficult to resolve, but I can absolutely assure you that within our own stock, there are very, 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 very clear criteria, and we do adhere to those.
Can we have numbers of people that come in from outside?
There will be estimates that do exist, but there won't be anything that is necessarily specific. Colleagues in adult social care and children's services and health will have an idea of people that have moved to the borough from elsewhere, and there is no single data set that will tell us this information. Like I said, estimates exist, and I'm happy to go away and try and find some of those, but I don't think it will ever be possible to know a true number, because there isn't a single way of recording that.
Rough estimates?
I wouldn't want to in this forum.
Ian, you've got a question, and then we go to Joe. You've had your hand up for a long time.
Do you want to go to Joe first, actually?
Oh, okay. Joe, if you want to go first.
Great, thank you, Chair. Like colleagues, I just wanted to say that I do welcome the housing strategy, and I'm very grateful to Ryan and colleagues for the high level of engagement we've had to align the housing and health and wellbeing strategies. The details in the housing strategy that Ryan have outlined go a long way to supporting Domain 5 in the health and wellbeing strategy and our ambition to level the playing field, particularly around affordability, as we've discussed, but also the quality of housing. So thank you to Ryan for that, and it's great that we're able to align the strategies so closely, and we'll be coming to you, Ryan, for our update on Domain 5 in the future agenda. I also just wanted to comment, if I may, on Councillor Ralph's observations about the importance of the green and blue environment within Thurrock, and this is something that we've also picked up within the health and wellbeing strategy, Domain 5. The public health team are working very closely with those leading the local plan development, and there will be a health and wellbeing section in the local plan. And the approach we're taking is to seek to influence future planning policy, the needs for health impact assessments, to promote things like inclusive access to green and blue spaces in all new developments. So that is being picked up through that local plan work. So I thought that it would be worth just updating the committee on that. Thank you.
Thank you, Joe. Ian?
Joe's kind of almost said what I was going to, but I'd like to also put on public record my sincere thanks to Ryan and Evelina. This has been a year in the making of incredibly hard work and comprehensive engagement, and I think this is the first time we've got housing completely and beautifully integrated with wider health and wellbeing and care strategy, particularly the health and wellbeing strategy and case for further change. So yeah, thank you very much, guys.
Thank you. Stephen, you've got your hand up.
Yeah, Steve Porter from the MSE Alliance at Thurrock. Just want to echo Ian's comments. It's very expansive and ambitious, but it's actually what I think Thurrock needs. It does very clearly also reference the wider health and social care issues and partnerships. For example, you know, you can't have a joined up strategy on homelessness if you don't include health and social care, particularly things like substance misuse issues and domestic violence and other things like that. So I think it really does take a very bold stance on some of this stuff and making sure that we do get things joined up. And I would commend the strategy.
Did you want to comment at all on that, Ryan?
Just appreciation for the comments. Thank you for that. We have tried very hard, and we know that housing is not just something that we have within our own stock. It's something that touches absolutely everyone. Like I said, everyone has a housing need, and it's right that we've reflected that. But thank you for your comments. It's much appreciated.
Councillor Johnson.
Thank you. Thank you, Chair. I echo the comments all the way through. I'm really happy with the report. And a breath of fresh air, when you mention the word affordable, it should be looked at on a single individual basis. There's no two ways about it, because there may not be a lot of difference in reasons, but there'll be a lot of difference in circumstance. And as long as they're taken into account, that's going to work. You never know. It may even help us define the word vulnerable as well, if that's looked at more on a single basis, because the list of vulnerability, as far as I'm concerned, it's irrelevant. It has to be looked at on an individual basis. If you're doing that with affordability, I think that's a really good way forward and a great step. And estate regeneration, I mean, I know previous portfolio holders have mentioned it as well. It's very, very high on the list, and the engagement you have now with the residents is so important to get that estate regeneration right. I mean, they're expensive. They have to be done first time and get right first time. Thanks, Ryan.
Okay. Any comment? Has anybody else got any questions? Yeah. I've just wanted to check that nobody else had got a question. I can't really see the screen too well. I've only got them couple of faces out. I don't know if you can see any more, Darren, on yours.
No, I can't see any more. I'll
Okay, thanks. So, Councillor Muldowney, you've got a very quick question.
I hope so. So on page, where are we, 21. So I was really glad to see that identifying and providing the right homes for Thurrock based on household needs. So I understand that the biggest demands for 1 and 2 bedroom properties. However, I do think that there is a cohort of people who need larger properties, and I'd just like to, certainly on behalf of residents from my ward, just flag that up. So obviously you want to build those kind of properties, but also what in this strategy will enable you to look at the people in different wards that are in the most need? So for example, I've got a family that have been living in severely overcrowded conditions. They need a 5-bedroom house, or in a 3-bedroom house, and there is, as we've discussed, special educational needs and other health needs within the family. So I can't get this family moved. To me, this family should be a priority for getting into housing.
Sorry, Councillor Muldowney, I don't want to go into individual cases.
I
very much appreciate that.
It's just an example. My question is, you've actually quantified how many new dwellings we need. So a net annual affordable housing need of 472 dwellings. Obviously, we haven't been meeting that for quite a number of years. I see that there's a commitment to deliver at least 500 new social and affordable homes for households in the borough. Is that per annum?
So that figure is for the lifetime of the strategy. The figure for the number of affordable homes required is across the borough, not just within our stock. One of the real significant factors that we have in Thurrock, which is what places quite a degree of pressure on us as a local authority, as a housing provider, is the relatively few number of other social and affordable rented homes that there are in Thurrock. The Housing Association stock levels in Thurrock is disproportionately small compared to other authorities with a stock level of ours. So if we're not directly delivering ourselves, it's trying to work with other housing providers to come to Thurrock and build their homes here as well. So it's trying to achieve that, which will really unlock the potential for affordable home delivery in Thurrock.
So we're only expecting to deliver about a fifth of the affordable housing need that we need in the borough per year.
at present, that's our pipeline that we have at this moment in time.
I mean, just to ask, can we look at that and maybe stretch? Because obviously, I mean, you might be able to attract. That seems a lot to have to attract that we're not doing ourselves, and I'd like to see more of a stretch going on that. So maybe that's something you can take away and think about. Thank you.
Absolutely.
Thank you. I'm sure Elowina and Ian will talk to you about the individual case, but I don't think it's right to in the room.
It was an example.
Okay.
It's an example.
Yeah.
It's an example of a wider need. Yeah.
So if there's any more questions from anyone? No. So going on what Councillor Ralph and Councillor Muldowney said, the gardens and affordability, I think there's a big piece of work that we can do with developers on asking them for some innovative ideas on affordable housing, and actually them really coming back to us, because they should understand affordability. I know there's profit margins and everything, but we've really got to nail this affordability. And often when we go to flats and smaller housing, we have communal gardens, and we say, well, that's great, we've got a space provided for those residents. But often those communal spaces are they're maintained on a contract with someone, and there's not any kind of personal space, and people aren't always allowed to add to that space. And I think that's what we're trying to say here, that if we want to improve health and well-being, we've got to give people the ability within that space, and I think that's something we should be looking at with developers as well. But also taking on board that not everybody wants to garden, and you don't want a bed of weeds. If I carry on, you can just come back to me at the end, if that's all right. So also for me, it was good to see a 5.4.2. One of the objectives is providing the right types of homes, future-proofing homes to change and adapt with our abilities and care needs as we grow older, allows us to stay at home with loved ones for longer. But it's important to recognise too that if you don't have family, being cared for at home can be incredibly isolating. And so it's good to see the housing strategy joins up with health and well-being and adult social care, so that we get a good mix from the right housing and sheltered accommodation for homeless and those escaping domestic violence, as you said, for example, to considerate planning for more vulnerable residents. I'd just like to echo Councillor Spielman, the Cabinet Member for Housing, when he says there's no need for anyone in Thurrock to be homeless. So please, if anyone does know of anyone in the borough who is, just make sure that they contact the council, their local ward councillor, to get some help. And I'd like to say that I've been very vocal and openly challenging and sometimes quite critical of decision making, whereby the consequences of the actions taken have not always included the effects it will have on our stakeholders and partners. So my question and challenge to you as well is, how are you engaging with and sharing data to inform alliance partners and consider their input and concerns for consequences and actions that you take going forward?
Thank you, Councillor. So just two points from a little bit earlier. On the point of gardens and people taking ownership, we're doing some really interesting work in Ockenden actually at the moment, and we are engaging with residents within blocks to do exactly that, where they have a want to be involved, of course, and allow them, give them the ownership over the space to make it what they want it to be. On the developers, in the same way as Joe outlined with the health and wellbeing strategy, trying to influence the local plan. So that's our aspiration with the housing strategy as well. So we aim to influence the local plan to help ensure that it meets the needs of Thurrock residents, and people coming to build in Thurrock understand that as well. So just to share that. For us, the consequence, the most significant consequence of decision making is on individual households. We may change, we may look to change a policy, we may make a decision in a particular case. The approach set out in the strategy is one of collaboration and partnership. And as I said, it's not just professional partnership; it's partnership with all involved stakeholders. So I think my answer is, how are we trying to collaborate? How are we trying to engage? It's understanding the people we're working with and reaching that right outcome together, rather than imposing a decision. I think that's the last thing we want to be doing. We really want to empower our officers to make the right decisions to help that household live a good life. So that would be my answer.
Is there any other questions? No. So it's recommended that members note and, well, we've commented, I think, for sure, on vision, aims and objectives and actions outlined in the Housing Strategy 2022 to 27, and note and comment on the aims and objectives and actions outlined in the Housing Assessment Management Strategy and the Housing Resident Engagement Strategy, both of 2022 to 2027. Are members content to approve the recommendations?
Agreed.
Agreed. So agenda item 6, children looked after needs assessment. If we move on to this item, the covering report and supporting documentation is provided at pages 231 of your papers. There's 30 minutes again has been provided for this item, comprising of 20 minutes presentation, 10 minutes of questions. So I'd like to ask Joe Broadbent and Elizona Ume, I hope if I pronounced your surname, thank you, to introduce this item.
Thanks, Chair. Elizona will be giving the detailed overview. I just wanted to say a couple of things at the start. Firstly, to thank Elizona for her ongoing tenacity and input on this report. It's been quite a long-term project. It was started pre-COVID, like the housing strategy was, and with the intervention of the COVID pandemic has required quite a lot of updating since then, and a lot of liaison with stakeholders who've changed through the process. So thank you to Elizona for that. It's been quite a long-term process, but we're really keen now to be moving on to the stage where we're actually addressing the findings of the needs assessment, rather than continuing to sort of review and update the document. I just wanted to remind the board just about needs assessments and the joint strategic needs assessments that we produce in public health for the board. A needs assessment is an objective assessment at a point in time of need and unmet need. So we've done our best to take in a broad range of evidence to assess that need and made recommendations on the basis of it. But I just wanted to stress that a needs assessment is not a service review, it's not an action plan, and it's not a strategy. And particularly with complex topics such as looked after children, I think it's really important that we take those findings into a multidisciplinary environment and consider how to address them in drawing up actions in response to the needs assessment. So Elizona will talk about what our suggestions are for the next steps. So I just want to say that's the sort of the status of the document as it is currently. And I'll hand over to Elizona to take you through the detail.
Thank you, Joe. Hi, everyone. Thank you for having me today to discuss the children looked after JSNA. I'll start off, next slide, please. I'll start off by just giving some context of how this came about. In 2017, Ian did quite a robust annual public health report, which I supported, looking at the sustainability of children's social care. We looked at the pressures experienced by the social care system, looked at some of the numbers within the social care system and how we can work to reduce some of those, and explored some of the financial opportunities then, and of how to perhaps in relation to reducing that system and some of the preventative actions that could support. In that piece of work, we recognised that there was a gap in engaging our looked after children, our foster carers, our professionals, and we wanted to align the purpose of this needs assessment to address some of that. So we captured lived experiences of looked after children, foster carers, and professionals caring for looked after children, really. And as Joe explained earlier, we looked at the data systematically to understand health and well-being, need as a whole of this group of population as well. Next slide, please. to give some sort of a context, why nationally, why your needs assessment for looked after children, as we know we have a statutory responsibility, isn't it, to as corporate parents to safeguard our children within this Children and Social Work Act. So our safeguarding responsibility is a turn to address some of these. We equally we know that children and young people enter into the care system experience some poor care outcomes as well, poor health and well-being outcomes, and that when compared to the general population, we know that only about 7.2% of children in care achieve grade 5 and above in English and Maths, and that's nationally, not just locally, really. We know that children looked after are about 4 times more likely to experience mental health problems or being involved in a youth justice system. So the inequalities associated with being looked after are quite stark as a population group, really. We also know that with increases in population, as we've seen within the ONS 2021 data, presents a likelihood that perhaps local authorities might experience increase in the population of looked after children. We've not seen that happen yet, but there are other circumstances around. For example, the Ukrainian resettlement scheme perhaps might be contribute to that population growth, but that is not what we're seeing yet in Thurrock. Locally, this needs assessment supports, next slide please, Domain 1 and 4 of the Thurrock Health and Wellbeing Strategy, which was discussed at this board, at the last board, and presented some of the opportunities for improving outcomes. So for looked after children, Domain 4 and 1 are aligned to staying healthy for longer and creating opportunities which provide some sort of a deeper insight into meeting some of the needs, really, for this group of population. For children in particular, the Brighter Futures strategy captures our ambition, really, for every child in Thurrock, and including addressing some of the strategic priorities across accessing the appropriate services for children looked after. Subsequently, our Working Together guidance supports a multidisciplinary approach to safeguarding our children through our local Safeguarding Children's Partnership Board, of which Public Health and our partners are quite involved with, as you may know. Some of the data locally around looked after children. Our ambition is to keep them safe, of course, happy, successful and secure. We, in March 2029, there were a total of about 300, and this was at the time of writing. I'll keep reiterating that. Children in care, with 147 children who started looking after care. That accounted for about 32%. According to that data, we could see that the trend is now stable of looked after children. The rate of our looked after children is now stable between 2019 and currently, which is a good thing, and that has stayed stable for quite a couple of years. For unaccompanied asylum-seeking children, we do have about 24 in our population group of looked after children, which is within the expected population, non-accompanied asylum-seeking population we should be holding within Thurrock as part of the National Transfer Scheme guidance. For care leavers, we currently support about, at the time of writing, which was in about December 2021, 281 children being supported, young people being supported through the looked after service, which has now reduced by 2021 to about 181, which is quite a great thing. The needs assessment, next slide, looked at we assessed the relationship somewhat between deprivation and the rates of looked after children by ward. We did find some sort of a strong relationship between deprivation, levels of deprivation, and the rate of looked after children. Children living in the most deprived area were 4 times more likely to be taken into care, for example, than those living in the less deprived area. Next slide, please. Placement, we did look at placement as a stability indicator for ensuring children build some sort of and sustain some important relationships while in care, and that is not just in relation to professionals but other adults that they trust as a protective factor. This measure is different. It's measured in different ways. There is the Stability Index, which is being published usually by the Children's Commissioner, and through the DFE, there is a Child Stability Index that we look at to address some of those. Overall, there are 3 stability indicators, which is around social workers, placement, their home placement, so placement category, and the school, which we've looked at. And we found within the Children's Commissioner report that 77% of children have experienced at least one change in social worker. 49% experienced at least one placement change, and 3% experienced at least one school move. So our school placement in school is giving children quite good stability within Thurrock. In relation to care leavers, being in a suitable accommodation in education or training provides a chance for improving their outcomes and some sort of stability as well. And in 2020-21, of our Thurrock care leavers in suitable accommodation, there were about 86% who were, majority of our Thurrock care leavers were in suitable accommodation. 9% were recorded as leaving in accommodation, which were not entirely, most of it were in relation to being in custody, really. So I would highlight that it's not that our children aren't in stable accommodation. They are, but in some instances they're in custody, of which we can help, really. Next slide, please. We looked at children in care, care leavers, and some of the experiences of emotional well-being, really. There was a published survey conducted by the Office of National Statistics, which estimated that about 45% of children aged 15 to 17 years old would normally have a diagnosable mental health disorder. What we did was applied that prevalence rate to our population of looked after children in 2021, 2020, and we estimated that about 134 of our children would normally have, of children looked after, would normally have a diagnosable mental disorder. And although the estimate did not include children in, who are young people who are leaving care, we estimated, using that estimate, prevalence estimate, that 126 perhaps of care leavers would normally also have a diagnosable mental illness. Equally, the average, there is another indicator which uses the strengths and difficulty questionnaire to look at scores for children and young people in Thurrock, which suggested that 14.2 on average would perhaps experience or equal, their mental well-being is on borderline cause for concern. This is similar to East of England. This is similar to our national average. So in light of the need in mental health, we need to utilise this information in service planning, really, which our CAM service do utilise. As mentioned earlier, we conducted quite an engagement exercise. Next slide, please. With children looked after, our foster carers, and our professionals. It was quite a useful engagement process. That was in 2019, I would reiterate. But we did get some positives that children expressed as their lived experiences within care. they reported, quite a good proportion reported they felt safe, they felt secure within their placement, and they felt being care supported and to develop strong relationship with their foster carers, which for those in foster placements, which was quite good. Children felt they were included in the decision making about them as well, and their foster placements were favoured as part of a placement option for those who participated. To make clear, all children who could read and write, so from about 6 years old to 18, were offered an opportunity to participate in this engagement. And some of the main concerns about being in care that they highlighted within this engagement process were social worker turnover. They felt that they've had different social workers at different points in time. Some of them felt worried when they weren't listened to, for example, and they were quite unsure about the advocacy service, which is a service that is quite crucial in facilitating children looked after and professional relationships, really. In hindsight, I did recognise that there was a gap in our knowledge about parents who have voluntarily given their children up for to being looked after. So further, perhaps engagement would include some of those elements, as well as gap in the voices of experiences in transition of care for care leavers, really, as well. So the recommendation, one of the recommendations is to look into that. Next slide. As part of a needs assessment, we conduct some sort of a service mapping to explore what services are available, and we've stratified that to, of course, the universal and early help offer, some of the targeted offer around prevention and support services, and our specialist services, which is around CAMS service, our advocacy service and specialist offer for our looked after children, including their initial health assessment offer and their review health assessment and social work. In conclusion, we looked at, on the next slide please, some of the main needs we've identified are the risk of possible exposure to or experiences of ACEs in toxic trio. So we looked at the vulnerability of becoming looked after in the extended version of this document, where we looked at, which is ranging from parental and family and societal or environmental factors, really. And we recommended that there is a risk, that there is perhaps looking at understanding the risk of exposure to ACEs and toxic trio. So toxic trio is exposure to domestic violence, exposure to alcohol and drugs and mental health issues, and to understand that a bit further and work out how we can utilize that information to address vulnerability of risk factors, really, or exposure to those risk factors. As I mentioned earlier, children did highlight that they were concerned about the high turnover of social worker, and the stability index also mentioned some of those in the data, and there is a need to look at how this impacts on our service provision as well, to look at addressing that. Awareness of the advocacy service require further facilitation. It's quite an effective tool, effective offer, which builds support children to build very positive relationships, really, between professionals. That's a need that we did identify within this needs assessment. Professionals did highlight, when we engaged with them, they identified a need for access to mental health services for children and young people as a necessary, which needs to be improved, and other health and care needs that we also established was utilizing the initial health assessments and review health assessment in addressing this needs. For example, we did notice within the sexual health service that we commissioned, we would look at improving our knowledge of how our looked after children and care leavers access that service and other health and well-being needs, really. In conclusion, the needs assessment provided a comprehensive assessment of health and well-being. It explored some of the lived experiences of this cohort of population. We looked at, we used an engagement process to highlight some of the areas that are positive and within lived experiences of children, and those areas that also need addressing. We have categorized some of the recommendations into quite broad categories with detail within the report, which is around reducing risk and enhancing safety, addressing some of the findings from the engagement and broader health and well-being needs. As a next step, the ask is for an approval here at board. We would present this to the local safeguarding partnership board, and begin to explore some of the actions following the recommendations through our Children Looked After steering group. And I do want to acknowledge quite a range of stakeholders that have participated in delivering this needs assessment. And I'll stop there and take questions.
Thank you. Does anyone have any questions?
Yeah.
Councillor Ralph?
Yeah, thank you for that, Paul. Very, very timely, and it's very self-critical, which I actually quite enjoyed reading. Based on the fact that last Friday I met with a group of 5 foster carers who highlighted some of the issues they're going through at the moment. Mainly that they felt that there wasn't enough communication with them and the other services that they need to support them. And sometimes they felt a little bit shut out. The other issue they had that when their child that they were looking after was behaving badly, they felt they wasn't given any other support apart from trying to get the child diagnosed with a mental health issue. And they're saying, no, the child is just having a little bit of stress at the moment.
Councillor Ralph, as I said earlier, I don't want to go into individual cases.
No,
if
it's
you
not
could
individual. No, not individual.
Sum up your example and get to questions, that would be great.
Yeah, it's not individual. So this is those sort of issues that are coming up constantly with these people. And at those 5, most of those, their children had gone through 6 or 7 different social workers. So I know it's hard for us to maintain a level of employment with some social workers, and the turnover seems to be quite high. The third years I'd really like to try and knuckle down and focus on that constant, that child has that constant social worker through their relationship while in foster care. And I know that's really, really difficult, but also better communication with the foster parents, I think, would be a better idea going forward. I don't know how that can be explored in your recommendations. And also the thing about the behavioural side of it all, more assistance in maybe joining up foster carers with groups and support groups. I don't know if you have anything about that in plan.
I'm aware that within children's social care there is social worker retention program. There are options which they're looking at in ensuring that stability of social work for each individual child that is looked after is there. With regards to communication with foster carers, I believe that each foster carer have a social work supervision, isn't it? I'm looking at Sheila now, have a supervisory social worker which they would engage with regards to facilitating or coordinating any approach they would have. So in individual cases can be picked up with that supervisory social worker. As mentioned, with retention, there are options that Children's Services are exploring as part of ongoing work.
Sheila, did you want to come in there before Councillor Ralph comes back?
Sure. I mean, yes, it's always good to have a look at your service and for that to be as objective as possible. this is a moment in time as well, and I think this relates back to 2019, perhaps. So we are 2-3 years on. But obviously, Councillor Sand, you're saying you were hearing the similar things that were being said by 5 foster carers that you met with. What I want to say initially is our turnover rate for social workers at the end of March was 16%. Nationally, it is 16%. So we are actually doing fairly well in Thurrock in terms of holding on to our social workers and maintaining them. However, if you are a child and you experience just one change of social worker, that always has an impact on that child, because you want to form a relationship and you want to keep that relationship. So we know how critically important that is to get good social work outcomes for children, looked after and not looked after. So we constantly look at our recruitment, our retention processes for social workers, and you know, I feel we do very well. And if you speak to, there's been an LGA testing of how social workers feel about their employers across the country, and we came second in that. I think it was nationally, second regionally across the Eastern region, and 22nd out of 150 authorities nationally. And that's completely anonymous, random for our frontline social workers. That being said, it is a national recognised issue about recruiting and retaining social workers, particularly in children's social work. Thurrock has a very good offer, so certainly on salary we've got a very good offer. We also have a good offer on training, on caseloads, on manager rates. So it is an issue for everyone. What I would like to be really clear about, that we're not an outlier in terms of being worse than others, that we certainly are holding our own in terms of social work recruitment, but it's not something we can be complacent about, because actually it is the most critical part of social work, is the relationship that people form, whether you be looked after children or families, with those workers. In terms of our foster carers, we've got a number of foster care support groups, and I'd certainly be willing to talk to you about if those foster carers are linked in with those. We've got over 100 foster carers in Thurrock. You've spoken with 5 of those. It would be interesting for me to know, you know, where they are linked in, because we have a newsletter that goes out to our foster carers. You know, we meet with the support groups. We're really keen to, that's aside from the individual supervising social worker that every single foster carer has. So there are other groups and other ways of working with our foster carers. Again, we are really clear that if we don't have good quality foster carers, we're not going to get the good quality care that our children need. So they are issues that we are always looking at, and looking at ways of how can we improve, what can we do more of, what should we do less of so that it doesn't upset people, and what can we do more of to make sure that we both attract and retain good social workers, and we attract and retain good foster carers, because we know without those our looked after children will really struggle.
Yeah, thank you. I think I should explain is that, you know, it could be quite easy for me to sit here and say we've got a great service, because we do. We do have a great service. And I've seen other areas that do get this wrong, and we are not one of them. But the point of this report is to look at it critically and where we can improve. Those foster carers were talking about where they felt they could be improved on, and that communication line seemed that it could be broken somewhere along that line, and they were struggling. But overall, we have one of the best foster care services out there. So just thank you for all that. All the work you do is brilliant. But I'd say this report is just to try to up that level of support that we give. And thank you for addressing those issues. Thank you.
Thank you, Councillor Ralph, for your question. Councillor Lilliard?
As a former foster carer, and I found the experience really very good. And it didn't bother me too much that we had change in social workers. The only thing I would sort of recommend is that as soon as you know one foster carer is, one social worker is going to change, could you let us know? Because sometimes there's a little gap in between, and the kid might say, you know, I want to talk to my social worker, and we're not really too sure. You know, they don't answer the phone or whatever, and that can be a problem. The other point that Councillor Ralph made about groups, we found that it was the same sort of 20 or 30 foster carers that went to those groups. I don't know whether that's the same now, but you know, and there were 20 or 30 foster carers that seemed to be very well informed, very capable people, and the others were sort of on the fringe, really. Maybe it was that they weren't in communication or didn't have the technology or the ability even, I don't know. But certainly something needed to be done to bring those other foster carers sort of into communication. My thoughts were that they should have a modern phone that was provided by the council that they could use to communicate, you know, in every possible way, as you can do these days. I know that's an expensive item, it's probably 10 grand, but is that really expensive in sort of, you know, by comparison? So just some thoughts.
Yeah, I take on board the concept and the idea of what you're saying, and we definitely, I'm sure, Sheila, I'll let you come back and answer that, but we definitely do need to always find a way to engage with the ones that are difficult to engage with and find out what the barriers are.
Yeah, absolutely. And I think, I don't know if it's just human nature, but people group together and they form allegiances, alliances, and sometimes that can be difficult for newer people to get in because there's already formed, you know, good bonds and good groups. What we haven't been able to do in the last couple of years because of COVID is have our foster carers event. We used to have an annual event where it was an amazing opportunity then for all foster carers to get together and for those groups to make themselves known, to sort of say, you know, here's who we are. So we are having an event, I think it's September, October time, for our foster carers again. We've also got an event, I think, coming up in a few weeks at Grange Waters for looked after children with their carers. So again, another invite that's gone out to everyone. So it can't be seen as being exclusive to one of those groups because there's about 2 different foster carer groups. And those big events, we're sort of getting going again. We had one last year in Grange Waters again with looked after children and their carers, and that was really well attended. And again, that helps to bond, relate, because it's all about relationships. If you meet someone and you know them, you think, okay, I will connect with those. So we have got an event this summer at Grange Waters, and we've got another separate event just for our foster carers, just as we had a looked after children's event, I think it was last month, you know, and that's very much about trying to build a sense of community and collegiateness across everyone so that you don't feel excluded, as well as newsletters, as well as trying to keep people involved. I mean, I take the point about the change of social workers, because although we've got relatively low turnover, it's still not where we'd want it to be, but it's relatively low. There are some natural inbuilt changes. So for children, when they come, if they make a referral into MASH and it goes to our assessment team and they become looked after, there is a transfer built into that because they will then move to the looked after teams. There's a social worker in the assessing team and then it will move over to the looked after team. So you've built in at least one change there. So people have looked at systems and how can you change that. It's really difficult to change that because you hope that children are not going to need to be looked after. So at the very beginning of all our work, we're very much about trying to divert children, families, so that they get the support.
Sorry, Sheila.
I'm
going to have to ask if we've got 1 minute, and Jim would like a question as well. Could I maybe ask Councillor Lidiard that you continue your question with Sheila after the meeting? Cause
I was only going to do it for a few seconds. And that was, we have a very good WhatsApp system, again, for 30 people. And really that should be extended to
Thank you, Councillor Lidiard. Jim?
Just very quickly, thank you, Chair. Just to say that when children with safeguarding needs, including those who are looked after, reach adulthood, their safeguarding needs won't necessarily evaporate, they may well change. And that's when the Adult Safeguarding Board takes over. And to say that that's a potential area of vulnerability, that transitional phase. And we're working very closely with our colleagues in the Children's Safeguarding Partnership to make sure that we have seamless transference and transitional arrangements, and also the support for carers, both paid and unpaid. Thank you.
Thank you, Jim. Very quickly.
Yeah, really quickly, one more thing that was picked up in the report, and that was an Ofsted recommendation, was about initial health assessments. We are still struggling, 3 years on, to get that right. So we get the referral to our health colleagues within 5 working days, 85% of the time, but the actual initial health assessment being undertaken within 20 days is still hovering around the 49–50%, which is nowhere near where it needs to be. And I think it'd be really helpful for the Health and Wellbeing Board, because we've had it before come here, but a joint report with our health colleagues and social care colleagues to report back what the difficulties are around getting, our initial health assessments when children first come into care done far more quicker than 50% of the time.
Can we make a note of that, please, Darren, and get that included? That's a very important point. And you're absolutely right, Jim. Your problems don't go away just because you suddenly overnight became an adult and you're no longer a child. So there's some work there to do. Stephen, very quickly, I'll let you come in, then I'm going to sum this one up.
Very quickly, just in response to that last point, we are absolutely aware of that issue that's been raised about the 20-day KPI. We've approved a business case to address the delay, and we'll be monitoring carefully with NELT. I'm more than happy to come back and give an update on that next time, but hopefully it will have moved on before we get to meet again. But we are aware of it, and we're taking some action to try and make sure that is resolved.
Fantastic. Thank you, Stephen. Let's do that. We'll bring that up next time. Okay, Darren's made a note of that. Thank you. So one of your key findings in children's and adults' health, mental health, should foster more collaboration. I'd say that's a must rather than a should. We definitely need a more holistic approach for families. I know we've got this family first thing going on now, which is really great, so we should be building on that. But it's not just mental health, but it's the other needs too. It's health as well as mental health. It's education and a holistic look for the whole family, not just the child. We all know children learn by example from their parents and family and outside influences. Children and adults should, so therefore, like I'm saying, I agree, we should foster this more collaboration. Social care should be reviewed and initiate steps for improvement. Commissioning should work to enhance local data with sexual health services. For me, there was a lot of the term should. So whilst I fully appreciate its definition can be taken as the same as must, it also conjures up in my mind, and I'm sure others, well, we should be doing it, but we're not necessarily doing it, and we maybe could do it better. So does overusing the word should allow for too much wriggle room to not fully get on board with the actions by those that need to take the action, is my question. I know I'm just talking semantics here, but I feel when it comes to our overlooked children, our looked after children, we need strong, determined actions to improve their lives, and not just as children, but as adults too. So, I want to come back with a very quick comment because we're running behind now.
I understand where you're coming from with regards to the words. It's statutory. It has to happen, so it's a must. I'm going to pick up sexual health because it's an area within public health responsibility, and that is going to be taken on through procurement and commissioning activity in the near future. So I do take your comments on board.
Okay, thank you. Then it's a public document, and not necessarily as a public do we understand what's statutory and what's discretionary. So I think it might be nice to make that more robust so that people feel confident that it's going to happen.
I would make those amendments before the report is published.
Thank you. So it's recommended that members consider, comment and endorse the Children Looked After Needs Assessment for Thurrock, approve publication of this needs assessment in line with other joint strategic needs assessments for Thurrock, and support the delivery of its recommendations through the Thurrock robust areas of work for CLA. Are members happy to approve? Yeah?
Yeah, agreed.
That's all agreed. Thank you. And you'll put that action on, Darren? Yeah. So agenda item 7, Essex Southend and Thurrock Dementia Strategy Refresh. This item has been provided with 25 minutes on today's agenda, comprising of a presentation of up to 15 minutes and 10 minutes Q&A. A covering report and supporting documentation is provided at page 255 of your papers. I'd like to ask Catherine Wilson and Alison Hall to introduce this item. Thank you.
Thank you very much, Chair. I'm delighted to be here. Alison will be joining us shortly. She has had to attend an urgent regional meeting. So before I begin, I just want to reassure members and note with the board that we have proposed some minor changes to the draft strategy, some minor amendments, and we've already asked for Thurrock initiatives to be included in Appendix B, because I appreciate there may be some questions around that. So the amendments that we have requested are that we will include the Thurrock strategic approach, which of course is our further case for change document, that we will be having a local Thurrock implementation plan for this strategic approach for dementia, and to note that we are currently refreshing our carer strategy. In addition to that, DMT, our Directorate Management team, were very happy to endorse the strategy, but have also asked that we include the work around hypertension, around the preventative agenda, obviously vascular dementia, etc. And that will be included within that. And I know that Jo and her team will be contributing to that. But none of this will affect the overall message of the strategy, the 9 priorities that have been developed, and the commitments will remain the same. So, my report today is seeking approval from the Health and Wellbeing Board to adopt the draft set strategy for dementia, and also seeks to make the board aware of the plans to develop, as I've noted, a specific action plan for Thurrock. As you will have noted in the draft strategy, there are 9 priorities contained within it, and these have been very much shaped by people with dementia and their carers. And those 9 priorities cover the areas around prevention and support, particularly support for unpaid carers, to enable the reduction of the risk of crisis, so ensuring that support, information and advice is available so that crisis is reduced as much as possible. Timely diagnosis is also very important, and support following that diagnosis. And then the final 3 priorities are about really living well with dementia for people who experience it directly and for carers who support them. So supporting people to remain in their own home and in their own community, ensuring that if people need long-term care, that is timely and appropriate, and ensuring that end-of-life care is also appropriate and in a place of someone where someone wishes it to be. We have, in spite of all the kind of restrictions that have been in place over the last couple of years, people have been able to contribute to the development of those priorities. And you will find that they do actually reflect national research about what matters to people with dementia. So this is a joint health and social care strategic approach, and the commitments, we hope, will be signed off by the 3 local authorities and across all of our health partnerships. Although we are working across Greater Essex and across all of the boundaries of health and social care, as I've noted, it's really important that we have our own Thurrock implementation plan. So this is going to be developed as a joint health and social care document, and it will have dedicated engagement, which is going to be undertaken by Healthwatch Thurrock. We've included in this face-to-face activities to ensure that everyone has their opportunity to say what they think and what their experiences are of living with dementia and caring for someone who has dementia. The engagement itself is due to start around about now, and the implementation plan is due to be published at the end of this financial year. And the reason for that expansive time is to ensure that we have meaningful engagement and are able to talk with people who do have lived experience of dementia and their carers and families, and also professionals within the field. Also to then give us time to draft the document so that people can appropriately comment on it, and for that document to be taken through appropriate governance structures. The implementation plan will be matched to those 9 priorities that I've already mentioned, but also very much to the needs and real experiences of people in Thurrock. And progress on the plan will be brought to the Health and Wellbeing Board to monitor that. So I think the most important points are that the priorities were shaped by people who live with dementia and their carers, that we're going to have that local implementation plan, and that Healthwatch Thurrock are going to lead on that for us. And I think that's everything. Thank you, Chair. If anyone has any questions.
Thank you, Catherine. Does anyone have any questions? Councillor Muldowney?
Well, I'll comment more than a question. There might be a question that comes out of it. I think it's really good to see that the priorities have been shaped by patients who are suffering from dementia and their carers, and that there was wide consensus, not only in the professional group across Essex-wide, but also with people actually living with this condition. So I thought that's very good. I also like the fact that we're going to have a local implementation plan. I think that works really well to think globally across the Essex area, but then act locally. I think you're going to get the best combination of results from that, so that's really good to see. From your point of view, I suppose my question is, what do you think are the risks to not being able to deliver the strategy?
I think it's the age-old risk of, capacity and funding, and also, just there are a lot of people who have dementia within Thurrock, and we need to be really clear that we can offer services. So I think there are some risks, but we're going to mitigate those as much as we can, and we have, really good relationships with our voluntary sector, and we have agreements with Alison. Perhaps you can help me with it's the Alzheimer's Society, isn't it? And yeah,
if I can just support Catherine there. Yeah, we have a very good relationship, as Catherine said, with our voluntary sector, particularly the Alzheimer's Society, and the work that we've been doing with the Alzheimer's Society over a number of years across health and adult social care in the region. Our approach is held up as an exemplar because our Alzheimer's Society sit within the dementia clinic, so that they are working with those service users, those people with the diagnosis, and their families and carers very early on, so that we can support them through their dementia diagnosis. And I suppose that goes to support that question that you asked around some of those difficulties that we might encounter around delivering on the strategy. And one of those mitigations is that we try to support people as early on in their dementia diagnosis around keeping them at home, keeping them within the community, and working with them as early as possible to support them. I hope that answers your question.
Yes, thank you.
Thank you. Councillor Ralph and then Stephen.
Yeah, thank you, Chair. Yeah, so Alison sort of just answered my sort of question. I was going to ask about tapping into the Alzheimer's Society because they maybe help us get over some of these hurdles that are coming in. It's a very comprehensive strategy. I really hope that we get this through. One thing I'd say is that getting the feedback from the users, service users. I know the Health Watch helped us before with getting the consultations out. Are we sure that they've got the manpower to get to do this time?
Yes, I think we're very confident. It's a separately commissioned piece of work, and they are able to offer the support that we need to ensure that this is comprehensive. Yes.
Brilliant. And the only thing that it struck me about reading the report, most people feel that dementia is hereditary. It's in your family. Reading that report, it's very clear it's not. There are other conditions that factor. And that general public education on that, I think that's quite lacking. So getting that information out there to the public that these factors can cause it could be quite useful as well.
Absolutely.
Thank you, Councillor Ralph. Stephen?
So I read this and I thought it was very good and very all-encompassing. But just to be sure, I had a meeting the other day with the Alzheimer's Society, and Mrs. Stockwell Lance was very, very supportive of it as well, and provided me with assurance that actually we've got this right in terms of the balance. And of course, you know, we think about this in terms of older people, but actually dementia and Alzheimer's can strike people at a younger age, and people who wouldn't normally meet the threshold for, you know, social care or health intervention certainly, but not necessarily social care. And this really does try to sort of take a sort of a wider view of the whole thing, and very much in particular, as we've heard already, the impact it has on carers and the fantastic work that carers do in unpaid capacity, family carers, working with people. And I think there's a real balance to be struck, and I think this does do that in terms of maintaining people's independence, not taking what skills they've got away, just providing the right levels of support at different stages. And I think this looks at all sort of, the whole sort of social and health side of things. So it has our support, and actually from the health service side, absolutely we'll work very closely with partners across the health and social care system to deliver better and improved outcomes for people with Alzheimer's. So I commend the report.
Thank you, Stephen. Are there any other questions? Sorry, I can see hands up, but I can't see names. So Alison, would you like to come in there?
Yeah, hi. Sorry, I was just going to come back in on Councillor Ralph's comment, particularly around, it's often lifestyle choices that, can affect dementia. And one of our ambitions is to increase and work, do some more work around those dementia-friendly communities. And if we do that, then obviously that is about that information and notification around dementia, and how dementia affects people. There's obviously lifestyle choices, particularly alcohol and diet. So included in some of our ambition is to increase our dementia-friendly community.
Thank you. Catherine, did you want to come back at all before I speak?
No, I think that's fine. Thank you, Chair.
Thank you. I really like the sound of the dementia-friendly schools. I think children learning about dementia supports them emotionally and helps their understanding of not only if a relationship with a loved one at home, like a grandparent, for instance, is changing, but maybe why mum and dad are a bit out of sorts and upset. I love the Guardian Angel initiative. I think that's great. I'm not sure if you've thought about involving smaller independent local businesses in high streets, because what you do as a business owner, you build relationships with your customers and you see them come in and you notice if they're poorly, you notice if there's changes in their behaviour and characteristics. but you don't necessarily notice where to signpost, maybe, because sometimes that could be an elderly person that you know is on their own. I wonder if there's a piece of work to be done here, A, to increase the Guardian Angel initiative, but B, to also help us overall with health and well-being by connecting with businesses and helping them support their customers more.
Yes, I think that sounds like a really positive thing to do, and I think it's something we have done in the past to support people with learning disabilities by working with local businesses. So I think that absolutely we could extend that. I think that would be a really excellent thing to do.
Thank you. And then again, I just want to reiterate, as this is a really good example of the Alliance working across Essex and with partners, that when we do our own local one, that we're mindful of the consequences of our actions and talk about that with our partners before.
Absolutely.
So it's recommended that members agree the draft priorities and commitments contained in the refreshed Essex, Southend and Thurrock Dementia Strategy, the next steps in the development of a Thurrock implementation and action plan. We've noted your amendments that, as you spoke of, Catherine. Are members content to approve the recommendations?
Agreed.
Agreed. Thank you. So, agenda item 8, virtual items for members' consideration. As Chair, I'm keen to ensure that items are provided with appropriate consideration at board meetings. This has resulted in a reduced number of items being considered at meetings and the likelihood of members being asked to consider items virtually. These items are likely to be those which would have ordinarily have been provided to the board for information purposes only. This provides members with an opportunity to remain informed about key strategic issues and an opportunity to consider items in more detail at a future meeting if members wish. And if you've got any questions or you're not understanding, you can always come back to Darren and he'll make sure that we get the answers in an appropriate timescale as well. We have 2 items for members to consider virtually. It's the Leader Annual Report 2019 to 20 update, a briefing note and updated annual report provided by Rebecca Bailey will be circulated to members shortly. The pharmaceutical needs assessment, sign off of the final PNA as previously delegated by the Health and Wellbeing Board to the DPH and the PNA steering group. And the final PNA will be circulated virtually to the Health and Wellbeing Board during September before publication, which needs to be completed by the 1st of October. Are members happy to do that? Yeah? I think it's worth trying. Okay, that's agreed then. And then agenda item 9, the work plan. The board work plan is contained on page 295 of your papers. Should members wish to comment on items included on the work plan or indeed propose items for the board's consideration, please contact the Secretariat, Darren or Claire. Has anyone got any comments to make on the existing plan as it is? We're definitely adding in Stephen's report. Yeah, no further comments on that from anyone? No, so I think then we can close the meeting. As always, I thank everyone for their contribution. It's always a good discussion. So I'll close the meeting at, unfortunately, I've got somebody ringing me and the time's
12:20.
12:20. Thank you. I was just looking at it. So we'll close the meeting at 12:20 and thank you, everyone.